Although we don't know what kind of cancer she had, we know that it is in the abdomen. We know that it was, quote, a successful surgery. So we know that whatever disease was there presumably has been optimally taken out. And that's why she's now having this chemotherapy to try to treat whatever microscopic disease has been left behind. And then from there, we'll see kind of where her journey goes and whether she decides to disclose anything further as to whether she gets placed on surveillance where they will monitor her, or whether she'll get some sort of maintenance therapy to try to prevent this cancer from coming back. We know that she has a diagnosis of cancer, even though we don't know what it is, and we know that she's getting active treatment with chemotherapy. So I don't believe that they mean that the chemotherapy itself is preventative for cancer, but rather that we're seeing that a diagnosis has been made and the treatment is being undergone. And the preventative side of things is really just kind of giving chemotherapy to prevent this cancer from coming back. So a lot of the traditional chemotherapies, they are created to kind of attack the cancer cells and cause the death of those cancer cells. And as you can imagine, it can also sometimes cause an effect on the normal cells as well. Some of the most common side effects of chemotherapy include things like lowering of your blood counts, which means your immune system sometimes can take a hit, both your white blood cells as well as your red blood cells. A lot of chemos can also have effects on things like nausea and vomiting, like gastrointestinal effects.
It is surprising that whenever we hear of somebody young getting cancer, because it tends to be the disease of the old age. But recently, we have discovered that more and more cancers are being discovered earlier and earlier in life. And we think it actually is related to environmental and genetic changes that have happened over time. The wonderful thing is that now we have so many treatments for cancer that are highly effective. And using combinations of chemotherapy and small molecules and immunotherapies, even diseases that we used to think were incurable now can actually be brought back into the realm of cure. And so that's all good news. The recovery time after chemotherapy varies tremendously, but it's usually on the order of months. And for the young patient, though, they tend to recover faster for obvious reasons. And so on the one hand, we hate it when young people get cancer, but at the same time, they are the ones that recover best from the various chemotherapies and other surgeries and other therapies that we do.
And she's having what we call adjuvant treatment. She called it preventive treatment, same thing, adjuvant treatment, because the risk of recurrence is high. It doesn't mean she's got recurrence. It means that the risk may be high, and the adjuvant treatment is thrown in to reduce that risk. And although it's unpleasant, all chemotherapy is not something you want to do. It is of great benefit, and lots of clinical trials over the last 20 years have shown the profound benefit of the sort of drugs that would be given to her for this purpose. She's got a powerful family to support her. And I think that's so important for people. They need the support of a family. The tiredness you get with it is just the constant visits to hospital, the blood tests, the x-rays, the assessment scans. All these are part of the process of chemotherapy. And it does tire you out. So a bit of joy and rest over Easter will do her a lot of good, I would imagine. You know, that's what cancer patients find. They get support from the staff, doctors and nurses, they get support from their own family. And there's a sort of community of cancer patients. And also, she mentioned in her little speech about the mind, body, and spirit. And it's so important. It's not just the physical getting rid of the last cancer cell to cure the disease. It's all about coming out at the end of the journey better than where you were when you went in. Cancer's an absolute leveler, you know, rich, poor, black, white, it doesn't matter. We're all going to get it. Many of us, however long you live, if you live to be 100, your risk of getting cancer is considerable. It's a sort of, we're not meant to live to be over 40, basically. Evolution of Stone Age man was different than what we have now. And now we live a long time, and cancer's part of it. Cancer Research UK calculated about 1 in 2 of us are going to get cancer in our lifetime. It's never been so high. Many of the cancers will be cured, and every year you see improvements in the quality of care, the pleasantness of care, and also the outcomes, which are getting better and better every year. She is a role model, and I think it was tremendous to give that little video clips because, you know, it shows that she's an inspiration to other cancer patients that are beginning chemotherapy, that are on it, that are having radiotherapy, or any other treatment for cancer. It's not the end of the world. You can get through it in many cases.